I like to, first of all, in terms of the gut, I like to do extensive gut testing when I first meet somebody who's been diagnosed with Lyme, whether they've had treatment or not. It's really nice to know kind of what I'm dealing with. And I know that the microbiome isn't a perfect science yet, but at least I can get some insights. I can also check inflammatory markers. I can check leaky gut markers. I can do all those different things and try to get a perspective on how much their gut's playing a role. And clearly, I'm also doing extensive history and physical examination in that department because some people don't have quote unquote gut symptoms, but there's actually a lot going on there that may be interfacing with their body at large. So I'll look at that. And overall, I think I'm looking at how I can connect all these dots together with people. And one of the things I see a lot with Lyme is autonomic dysregulation. So it can come in many forms. So the autonomic nervous system is that unconscious regulatory part of your nervous system that we kind of, controls our breathing and our heart rate and all these different things, including our gut motility, all this stuff. So you'll see people presenting with some form of autonomic dysregulation, and in the gut, it may look like SIBO, or it may look like, small intestine bacterial overgrowth, bloating, or, constipation, or, some sort of motility issue. In their brain, it may be a lot of like neuropsych distress, low stress resilience, and different things like this. And of course, it can come in other forms too, like POTS, postural orthostatic tachycardia syndrome, where people, stand up from sitting down and they don't have good regulation. They may feel like they're going to pass out, or their heart's beating really rapidly in their chest. So that can have a strong connection with the gut because the vagus nerve, that cranial nerve that comes from your brain and affects your gut and a lot of your broad regulation in your body. And the mast cell system is also something I evaluate for early on, which has a lot of interplay in the gut. As I've mentioned, this is a part of your innate immune system response, or initial immune system response to the outside world, skin, gut, blood-brain barrier, sinus, whatever. All of it has mast cells, and if they become overactivated, it's going to affect the autonomic system too. It's going to affect the leaky gut, and I'm basically looking for cycles. I'm looking for negative feedbacks that aren't serving that individual, and how can I sort of work on them foundationally to correct them. I'll also be looking at the hormone system because, of course, it's affected. The adrenals and the autonomic have a lot of interplay, um, and on, and even up to sex hormones, thyroid, insulin systems, everything in between. But so you're looking for where the lack of regulation is, and how can I start to provide some of those signals of regulation as the body's been struggling to maintain homeostasis.